Hello everyone. Today I would like present my latest study. It's entitled Teledentistry and Artificial Intelligence in Dental and Oral Health Services for the Elderly in the Era of the COVID-19 Pandemic. It's a literature review. So my theme is Dr. Baharudin Talib, Dr. Asmawati Amin, Dr. Al-Karama, and Muhammad Nur Fadlan Taufik. So next we will talk about how is the COVID-19 pandemic. It's a kind of how is the elderly patient are high risk of severe illness and death if it infected. So the elderly is very vulnerable and high risk of being exposed to the COVID-19 virus, limiting and making it difficult for them to access dental and oral health service. Uh, but how about the dental and oral health practice during pandemic? So how to also we improving the quality of dental and oral health services during pandemic. The elderly has concern about COVID-19 contamination when they have to see a dentist. So their situation has led to discussion and efforts to use a kind of technology. There is like a use teledentistry and artificial intelligence to facilitate service and care for the elderly during the pandemic. What kind of problem about the dental and oral health problem that commonly occur in the elderly? It's like dental caries or cavities, periodontal disease, and tooth loss. But actually, based on the previous study during the COVID-19 pandemic in Brazil, the highest dental care for elderly included restorative and prosthetic treatment, followed by periodontal, oral surgery, and endodontic treatment. This study was conducted on the elderly age 60 years and or more who have internet access, which involved approximately 705 elderlies. So the barrier of the elderly to visit the dentist during the COVID-19 pandemic. The elderly population who has concern about COVID-19 contamination at the dentist tends to be higher. This due to increasing number of the elderly cases contaminated with COVID-19, and the low level of education affected the fear of being infected at the dentist. So as people get older and have a low level of education, they can have at first psychological effect such as anxiety, stress, fear, or panic during a pandemic. So change from the time to time, especially densely populated areas, the elderly are affected by feeling anxious and feeling that they are a population that's very vulnerable to the disease transmission. How about the cutting edge? So there is like a technology. We call it teledentistry and artificial intelligence. But the question is, what sort of teledentistry and artificial intelligence have been used? How this technology been used? So let's talk about how teledentistry and artificial intelligence have been used to assist the dental and oral health practice during the pandemic. By doing teledentistry, patient can communicate their complaints in advance and send photo to their of their teeth, so the dentist can analyze whether the case can be handled by doing the treatment at home and by carrying out oral hygiene at home, or issue that require emergency action. So the dentist can do the treatment as soon as possible, even the patient need emergency action. And then we talk first about the teledentistry. Teledentistry has been used in oral surgery, oral medicine, and periodontal condition, early detection the caries, and most importantly, disseminating preventive advice to the masses. Telediagnosis, teleconsultation, electronic patient records, and patient referral and are fundamental modes used in modern dental practice. Teledentistry is proven to provide access to underserved population, improve the quality care, and reduce the incidence of oral disease. So as we can see on this presentation, how is teledentistry works, patient at home or everywhere, and doctor in another place to can try to do a diagnosis or a consultation. As we can see on the table, teledentistry is useful in a kind of any discipline, like in the periodontic, we can do any consultation and diagnosis. In preventive dentistry, we can do consultation, caries detection and diagnosis. Oral medicine, we can do consultation, diagnosis, treatment and follow-up. In oral surgery, for sure, for consultation, diagnosis, referral system, or preoperative evaluation and of follow-up. In orthodontic, for sure, we can do consultation, diagnosis, emergency, or follow-up. And endodontic, we can do consultation, diagnosis, and root canal identification. And most of the discipline, we can use the teledentistry. Okay, there is the advantages and disadvantages. Mostly, we can see the advantages of the teledentistry. We can see access to care for underserved population, cost-effective, saving time, early diagnosis, e-recipe, and also can be for the data storage. But what is the disadvantage of the teledentistry? We still need the proper internet connection is required for the teleconferencing. The experience and knowledge of fellow dentists are also diverse. Most are still not legally tested also, and productivity can be another issue as practitioners are just getting used to using technology. How about artificial intelligence? So artificial intelligence, it's like kind of we can use for dental diagnostic, also for artificial in prosthetic dentistry, like using 3D or CAD/CAM. We can use in the radiologist. We can use like for diagnosis using like patient data recorded by via digital in intraoral periapical X-ray, 3D scanning, and so on. So this kind of artificial intelligence work. So the advantages and disadvantages of about the artificial intelligence, as we can see, there's addresses subjective variability of individual examination also, but the disadvantages is like depend on the use of software, and so that it requires updating according to latest technology. What is the conclusion and recommendation? Teledentistry and artificial intelligence can be an alternative for the dental and oral health services models to reduce anxiety and fear of being contaminated by COVID-19. Both make it easier for health workers, especially in dentistry, to maintain and improve the quality of life of the elderly during pandemic. But however, we have to also remember, first, internet access. We need internet access, considering patient from the rural area. Beware of malfunction. Double check the finding or diagnostic, technological hurdles and maintenance. Also, patient privacy, especially when the diagnosis is recorded. That's it. Thank you for time for me to present my one of my literature review. Thank you for today. Assalamualaikum warahmatullahi wabarakatuh.